Hello and welcome everyone. Myself Mijanur Rahaman and today my topic of discussion is sternum. Today we will discuss about the bone called sternum. So first of all, general characteristics. So all of us are known to that it is a flat bone and it is located in the median part of the anterior chest wall. So it is present in anterior chest wall and in the anterior chest wall it is present in the median part. Next, its length. How much is the length? The length is about 7 inches or 17 centimeter long. Now, it is mainly made up of spongy bone. So, it is rich in red bone marrow. So, it is made up of what? It is a spongy bone and it is rich in red bone marrow. And sternum has three parts. One is manubrium, second is body, and third is xiphoid process. Now, bony features. So in this part, this is known as jugular notch or suprascapular notch. Then these two are clavicular notch. And then here presence of sternal angle. And they are present notch for costal cartilage. There are total 7 costal cartilages. 7 costal cartilage notch. So what are the bony features? First of all, jugular notch. Second, clavicular notch. 2 in number. Then sternal angle or angle of Lewis. And then notch for first costal cartilage, second, third, fourth, fifth, sixth, and seventh. This first one and the half of the second present in Manubrium, and the half of seventh present in Xiphoid process, and the in between the half of second to half of seventh is present in body. So here is one and half, there is only half, and there is 1 2 3 4 4 total, half plus 4 plus half. So these are the bony features and general characteristics of sternum. Now we will discuss about the singular details. Now manubrium. As all of us know that manubrium, body and Xiphoid process, there are three parts. So first of all, manubrium. Manubrium is also known as pre-sternum. or episternum. And it is wider above and than the below. It is mainly broadly wider in the upper part. This is Manubrium. The upper part is more wider than the lower part. Now, it has two surfaces and four border. Two surfaces and four border. Surfaces are anterior and posterior, and borders are superior, inferior, and two lateral. So what are the borders? There are four borders and two surfaces. Those four borders are superior border, inferior border, this is superior border, inferior border, two lateral border. This surface is anterior and the behind one is posterior surface. So now we will come to know the attachment part. Anterior surface gives origin on either side to pectoralis major and sternal head of sternocleidomastoid. The pectoralis major is present like this in the both side, and the sternal head of the sternocleidomastoid muscle. So these are the attachment present on the anterior surface. So anterior surface has two muscle attachment. One is pectoralis major and the sternal head of the sternocleidomastoid. Now posterior surface. Posterior surface forms the anterior boundary of the superior mediastinum. Superior mediastinum. So what it makes? It forms the anterior boundary of the superior mediastinum, and it gives origin on either sides to sternohyoid and sternothyroid muscle. So what are the attachment of posterior surface? First of all, it gives origin to, and actually it forms the anterior boundary of superior mediastinum, and it gives origin on either sides to sternohyoid and sternothyroid. And each half of the lateral part of the posterior surface of the manubrium is related to corresponding parietal pleura. So what it is related with? As all of us know that behind the sternum there is presence of the inner part of the chest like lungs, heart. These are present in behind the sternum and the rib cage. So what are the content and what it related to it? Each half of the lateral part, okay, of the posterior surface of the manubrium is related to corresponding parietal pleura. And this surface is also related with vessels, like there are some vessels of the posterior surface, the related vessels. In the lower part, first, we all of us know that the arch of aorta is present at the level of the sternal angle, and in the lower part there is presence of the sternal angle. So in the lower part there will be arch of aorta, and in the upper part there is left brachiocephalic trunk, left brachiocephalic vein, sorry. Then second is brachiocephalic trunk, third is left common carotid artery, and fourth one is left subclavian artery. We have mentioned that left brachiocephalic vein, but why not the right brachiocephalic vein? Let's see here. If we take this as sternum, then here is the arch aorta, and we all of know that it is left subclavian, it is left common carotid, and brachiocephalic trunk. These all are related. I have discussed. Now we are going to discuss that there is left brachiocephalic vein, but why the right one not? Here is coming left brachiocephalic vein, and this is right brachiocephalic vein. Then the left brachiocephalic vein is coming more distance from and coming more closer to the sternum, but the right brachiocephalic vein is quite posterior, but it is not related with the sternum, and this together forms the superior vena cava. And superior vena cava is also not related with the sternum because it is quite posterior. That's why it is not related with this part. So you have cleared that concept that left brachiocephalic vein is related but right brachiocephalic vein is not related. And the related part are in the lower part arch of aorta, in the upper part left brachiocephalic vein, brachiocephalic trunk, left common carotid artery, and left subclavian artery. Now, borders of the Manubrium. The superior border, first of all, superior border is quite thick. And it has suprascapular notch or jugular notch, and two clavicular notch also present on each side. And the suprasternal notch gives the attachment to investing layer of the deep cervical fascia and interclavicular ligament. So suprasternal notch. So what it does? Suprasternal notch gives some attachment to the investing layer of deep cervical fascia and interclavicular ligament. So what are the attachment? Suprascapular notch got two attachment. One is investing layer of deep cervical fascia and is interclavicular ligament. Now inferior border. It forms the Manubrium-Sternal joint. This is Manubrium, this is the body, and this joint is known as Manubrium-Sternal joint. And this joint forms a little bit of angulation like projection, and it is known as angle of Lewis or sternal angle. This angle gives articulation on either side with second costal cartilage. And this costal cartilage is half in the body and half in the manubrium. And this we have discussed here. The half is present in manubrium and half is present in body. And in between them, the presence of Manubrium-Sternal joint or angle of Lewis or sternal angle. Now comes to the next border, lateral border. Lateral border forms the joint with first costal cartilage, which forms a primary cartilaginous joint. In the first part, there is connection of first rib, okay, and the first costal cartilage is connected with the manubrium with a joint, and this joint is cartilaginous joint. What is this? Cartilaginous, primary cartilaginous joint. And lower part has a demifacet or half facet for the second costal cartilage, which is a plain synovial joint. So we have got a difference between the joints of the costal cartilage. The first one is cartilaginous, and second to seventh, these six joints are synovial. So it is a difference. You can must remember it because it may be asked in your viva exam that tell the difference between the costal cartilaginous joints with the sternum. So first one only is the cartilaginous, and the second, third, fourth, fifth, and sixth and seventh also is synovial joint. So lateral border has the joints. In the first part there is, in the upper part there is first costal cartilage and primary cartilaginous joint is present, and in the lower part, in the position of sternal angle, there is present of second costal cartilaginous joint, which is synovial joint. So if we summarize that today in this part only, that sternum is a flat bone. It is present in the anterior chest wall, and it is present in the median part of the anterior chest wall, and it is about 7 inches or 17 centimeter long. It is mainly made up of spongy bone, so it is rich in red bone marrow. And sternum is made up of three parts. One is manubrium, one is body, and one is xiphoid process. And the bony features are, sternum contains suprasternal notch or jugular notch, clavicular notch, then sternal angle or angle of Lewis, then notch for the first costal cartilage, second, third, fourth, fifth, sixth, and seventh. Then we have come to the manubrium. Manubrium is also known as presternum or episternum. It is a wider in the above and lower than the below. Sorry, it is wider above than the below part. It has two surfaces, one is anterior surface and one is posterior surface. And it has four borders, that is superior border, inferior border, and two lateral borders. In the anterior surface, it gives origin to the on the either side of pectoralis major and sternal head of sternocleidomastoid. In the posterior surface, it forms the anterior boundary of superior mediastinum, and it gives origin to the sternohyoid and the sternothyroid on each side. And each half of the lateral part of the posterior surface of the manubrium is related to the corresponding parietal pleura. And this surface is also related with the vessels, like in the lower part there is presence of arch aorta, and in the upper part left brachiocephalic vein, brachiocephalic trunk, then left common carotid artery and left subclavian artery. And now the borders, the superior border is quite thick. It has suprasternal notch or jugular notch and the clavicular notch on each side. Then the suprasternal notch gives some attachment. We have already discussed that it is giving attachment to the investing layer of deep cervical fascia and the interclavicular ligament. In the inferior border, it forms the manubriosternal joint, and this joint forms little angulation called angle of Lewis or sternal angle. Then this angle gives articulation on either side with the second costal cartilage. Now lateral border. It forms joint with the first costal cartilage, which is a primary cartilaginous joint. So first one is primary cartilaginous joint, and the second to the seventh is plain synovial joint. Now we will discuss about the body part. Body of sternum. Body is the longest part of the sternum. So it is the longest one. And it has two ends, two borders, and two surfaces. If we take this as a sternum, then it has two ends, this one, two borders, this one, and two surfaces, one is anterior and the behind one is posterior. And the body is widest near its lower end. In the lower part, it is quite wider than the upper part. So first of all, the anterior surface. We will discuss first about the surfaces. Anterior surface. Anterior surface shows three ill-defined horizontal ridges. So what are those? These are the ridges. Because if you take this, so it has three ill-defined horizontal ridges. These are the horizontal ridges. Okay. And this line represent the fusion of four small segments called sternibrae. These are known as sternibrae. So this line represent fusion of four small segments called sternibrae. Sternibrae are four present. And these surfaces gives origin to the pectoralis major on the corresponding half. So anterior surface muscular attachment is pectoralis major only. Pectoralis major coming like this. And the horizontal ridges connects the sternibrae. Now posterior surface. The transverse ridges which are present in the anterior surface very prominently, in the posterior surface you cannot find these too much prominent, they are less prominent here. So it help you to determine the surface, which one is anterior and which one is posterior. So first, if you take this as the sternum body, then you can see that here will be the prominent three ridges in the anterior surface, but in the posterior surface there will be not that much prominent ridges. Okay. And the lower part of this surface gives origin to transversus thoracis. Transversus thoracis. And posterior surface is related to lungs, pleura, and pericardium. The manubrium is only related to parietal pleura only just, but in the manubrium it is related only to the parietal pleura, but in case of body it is related to lungs, pleura, and pericardium. Now, how it is related we will discuss then. On the right side of the median plane, the posterior surface is related to the anterior border of the right lung and pleura. So, if you take the sternum again, manubrium, xiphoid, and body. Then, right, left. On the right side first of the median plane, the anterior border of the posterior surface is related to the anterior border of the right lung. Here is present of the lung. So this is the lung, okay. And when you see that, you can only find in the right side there is presence of anterior border of right lung and the pleura. Pleura is the covering of the lungs, and in case of left side of the median plane, you can see that upper two pieces of the body are related to the left lung and pleura. The upper two part is related to left lung plus pleura. But in case of lower two pieces, there are four pieces we have discussed: 1, 2, 3, and 4. The lower two pieces are related to the pericardium, because here is the presence of heart and there is cardiac notch present in the lungs. That's why relation to the lungs and the pleura is not present there. There is the relation comes with the heart, and the in heart it is the relation is only with the pericardium. So if you take the body, then there is right side and left side. In the right side there is present of anterior border of right lung, then the pleura, and in case of left part, upper two segments, upper two parts has left lung plus pleura, and the lower two part gives origin to the pericardium. Relation, sorry, not origin. So I think you have understood this. In the right side, there is the relation is with the anterior border of the anterior border of the left lung and the pleura, and in the left side there is left lung plus pleura in the upper two segment, and in the lower two segment there is relation with the pericardium. Now the two surfaces are complete. Now borders. Borders are, there are two borders we have discussed. There are the borders are two lateral borders. So if we discuss one, that is enough. Two lateral borders. These lateral borders has two demifacet for second and seventh costal cartilage, and it has complete facet for third to sixth. So these 3, 4, 5, 6, there's these four complete facet and two demifacet. So these all, and we have already discussed in the previous part that these all joints are synovial joint. The first one is cartilaginous, and the second to seventh is the synovial. And between the facet, the lateral borders membrane provide attachment. So this gives an attachment to the external intercostal membrane and the internal intercostal muscle. These are ribs. So in between these, we have know that there are muscles. Intercostal muscle and the intercostal muscle. So there are external intercostal muscle and internal intercostal muscle. But there is a little bit of difference, okay? Between this facet, the attachments are, in case of external intercostal muscle, there is the membrane is in the front side. Okay, so there is first is connecting part is the membrane. You know that intercostal muscle are two. One is external and one is internal. And in the external and internal, in case of external intercostal muscle, the membrane is present in the anterior side, and in case of internal intercostal muscle, the membrane is present in the posterior side, posterior surface. Okay. So in case of this, the attachments are external intercostal muscle membrane and internal intercostal muscle. Okay. So if you see the diagram, in case first we draw the intercostal muscle. This is the intercostal muscle. Okay. Then in the upper side there is external intercostal membrane. These are the connecting parts, and these are the attachment. And from there starts the muscle of external intercostal. So this is, we have discussed the body. If we take a little bit the summary of the body, so body is the, and we have one part left. Sorry, there is two ends, in the upper end and in the lower end. In the upper end there is formation of sternal angle or angle of Lewis, and it was also form the in between the median sternum and the body. Manubrium, sorry, not median sternum. This is manubrium and body and Xiphoid process. So in the upper part there is formation of sternal angle or angle of Lewis or Manubrium sternal joint, and in the lower surface, lower end, there is Xiphoid joint. So there are two joints. In the upper part there is Manubrium sternal joint, and in the lower part there is Xiphoid joint. Okay. So if you take the revision, summary, then body or sternum is the longest part of the sternum. It has two ends, that is upper end, lower end. It has two borders. Those two borders are lateral border, this surface and this. And it has two surfaces, one is anterior surface and one is posterior surface. And the body is widest near its lower end. So first of all, the anterior surface shows three ill-defined horizontal ridges, and this line represents the fusion of four small segments called sternibrae, and this surface gives origin to the pectoralis major on corresponding half. Then posterior surface, these transverse ridges are less prominent here, and lower part of this surface gives origin to the transversus thoracis, and posterior surface is related to lungs, pleura and pericardium. Now the relation is discussed is on the right side of the median plane, the posterior surface is related to the anterior border of the right lung and the pleura. In the left side, there is only relation is with the right lung and the pleura, and in the left side, in the upper two segment, this and this, these are related to the left lung and pleura. But in the lower part, lower two segment, there is relation with the pericardium. And this relation with pericardium is because there is presence of heart and the presence of cardiac notch in the lung. So this, as the lung is present, that's why it is outer to the sternum. Now lateral borders. It has two demifacet for second and seventh costal cartilages, and it has complete facet for third, fourth, fifth, sixth costal cartilages. And these all are synovial joint. And between these facets, the lateral borders have provide attachment to the external intercostal membrane and internal intercostal muscle. Now we will discuss about the Xiphoid process. Xiphoid process is also known as Xiphoid or metasternum. So Xiphoid process is also known as Xiphoid or metasternum, and it is the lowest and the smallest part of the sternum and is of variable shape. So what is the Xiphoid process? Xiphoid process is also known as Xiphoid or metasternum. It is the lowest and the smallest part of the sternum and it is variable shape. It has no fixed shape. Each and every person has some little bit of difference in the shape. It has just and only two surfaces, that is anterior and posterior, and it has two borders and two ends. The borders are right and left lateral borders. One is right lateral and one is left lateral, and the two ends are upper ends and lower ends. So there are two surfaces, two borders and two ends. Those surfaces are anterior and posterior surfaces. Borders are right lateral and right borders, and the left borders, and those two are lateral borders. Anterior surface behind is posterior. This one and this one is right lateral and one is left lateral, and two ends are upper end and lower end. Lower end is just tip-like structure, not that much wider. Now anterior surface. Anterior surface gives insertion to the following muscle. It has some insertion like rectus abdominis muscle. And it has no, and one present is aponeurosis, not muscle. This is aponeurosis of external and internal oblique muscle. So anterior surface has some insertion like rectus abdominis muscle and the aponeurosis of external and internal oblique muscle. Now posterior surface. Posterior surface gives origin. These are insertion and these are origin. It gives origin to the diaphragm, not the whole diaphragm, just some or few muscle fibers only. Diaphragm, then transversus thoracis, transversus thoracis, and it is related to liver. This is liver relation. So in the posterior surface, it gives origin to the diaphragm and transversus thoracis, and it is related to liver. Now lateral border. In the lateral border, each gives attachment to the aponeurosis. Okay, we have covered the anterior and posterior surface. Now we will covering the lateral borders. Now each of the lateral borders gives attachment to the aponeurosis of, not muscle, aponeurosis of internal oblique muscle and transversus abdominis muscle. Internal oblique and transversus abdominis muscle. And the superior angle possesses a demifacet for the seventh costal cartilage. The superior angle possesses a demifacet in the upper part only. Here you can see the demifacet or half facet for the seventh costal cartilage. Now the ends. In the upper end, it articulates with the lower end of the body to form Xiphoid joint. Xiphoid joint. Xiphoid joint usually becomes a synostosis by 40th year. When you will become the age, when you will go to the age of 40th year, you can see that person has the bone formation or the proper connection between those two joints. There is called happening of synostosis. Synostosis is what? The Xiphoid joint become bony, and in the lower end, it gives attachment to the linea alba. So these are the total part of the sternum. If we take a very short summary of the sternum, that first of all we have discussed about the general characteristics. It is a flat bone. It is located in the median part of the anterior chest wall. It is about 7 inches or 17 centimeter long. It is mainly made up of spongy bone, so it is rich in the red bone marrow. And sternum is made up of three pieces: manubrium, body, and Xiphoid process. The bony features are: there is presence of suprasternal notch or jugular notch, then clavicular notch, then sternal angle or angle of Lewis, then notch for the first costal cartilage, second, third, fourth, fifth, sixth, seventh. And there are also the two joints we have mentioned. One is Xiphoid joint and one is Manubrium joint. Now we have discussed about the Manubrium. Manubrium is also known as pre-sternum or episternum. It is wider in the upper part than the below. Then it has two surfaces. One is anterior surface, one is posterior surface, and it has four borders. And these are superior, inferior, and two lateral border. Anterior surface gives origin to the pectoralis major and sternal head of the sternocleidomastoid. Then posterior surface, it forms the anterior boundary of the superior mediastinum, and it gives origin on the either sides to sternohyoid and sternothyroid. And each half of the lateral part of the posterior surface of the manubrium is related to the corresponding parietal pleura, and this surface is also related with the vessels like in the lower part, archa aorta, in the upper part, the left brachiocephalic vein, the brachiocephalic artery or trunk, and the left common carotid artery and left subclavian artery. Now the borders of manubrium, in the borders there is superior border and inferior border. The superior border is quite thick. It has suprasternal notch or jugular notch and the clavicular notch on either side, either side. Then the suprasternal notch gives attachment to the investing layer of the deep cervical fascia and the interclavicular ligament. Then the inferior border, it forms the manubriosternal joint. This joint forms a little angulation called angle of Lewis or sternal angle, and this angle gives articulation on either side with the second costal cartilage. Then the lateral border. Lateral border forms joint with first costal cartilage, which is a primary cartilaginous joint, and in the lower part it has a demifacet or half facet for the second costal cartilage, which is a plain synovial joint. Now body of the sternum. It is the longest part of the sternum. It has two ends, upper and lower end. It has two borders. These two borders are lateral border and two surfaces. One is anterior surface and one is posterior surface. And the body is quite wider in the lower end. Now anterior surface. Anterior surface shows three ill-defined horizontal ridges. These lines represent fusion of four small segments called sternibrae, and this surface gives origin to the pectoralis major on the corresponding half. Then posterior surface, transverse ridges are less prominent here, and lower part of this surface gives origin to the transversus thoracis. And the posterior surface is related to lungs, pleura, and pericardium. In the left side, relation are the left lung and the in the left side there is presence of in the right side presence of right lung and the pleura, and in the left side there is presence of, in the upper two pieces there is presence of the pleura and the lung, and in the lower two pieces there is presence of the pericardium. And the lateral border, it has two demifacets for second and seventh costal cartilages, and it has complete facet for third, fourth, fifth, and sixth costal cartilages. These all are synovial joint. Between these facets, the lateral borders provide attachment to the external intercostal membrane and internal intercostal muscle. Then Xiphoid process, also known as Xiphoid or metasternum. It is the lowest part and the smallest part of the sternum, and it is of variable shapes. It has two surfaces, one is anterior and posterior. It has two borders, right and left lateral border, and two ends, upper end and lower end. Now anterior surface gives insertion to the rectus abdominis muscle and aponeurosis of the external and internal oblique muscles. Now posterior surfaces. It gives origin to the following like diaphragm and the transversus thoraces, and it is related to liver. And the lateral border each gives attachment to the aponeurosis of the internal oblique muscle and transversus abdominis muscle. The superior angle possesses a demifacet for the seventh costal cartilage, and in the upper end it articulates with the lower end of the body to form Xiphoid joint, and Xiphoid joint usually become a synostosis by the 40th year. And in the lower end, it gives attachment to the linea alba. So I think I have cleared all the concept of the sternum very clearly. If you have any query, any doubt or any problem, you can comment down in the comment section. I will try to reply them. You have any question, you can also comment there. I will try to answer them. And do like, share and subscribe to my channels to support me. And thank you so much for watching.